I can tell you on the latest data that 290,720 people have been tested for coronavirus. 88,621 have now tested positive, and I'm very sorry to say that 11,329 people have now died from coronavirus. Every one of them a tragedy, and our hearts go out to all of the loved ones who are grieving their loss at such a difficult time.
Understanding that it's too early to consider relaxing any of the measures, could you share with us any of the specific ideas you're considering within government for how those measures might be relaxed when that time comes?
Well, I think it's far too early to talk about that. We're still, as Sir Patrick has explained, going through the peak. We are doing all of the work in government to assess the evidence. We'll be guided by the science and the medical advice that we get. And I think until you've got that evidence, we'd be getting ahead of ourselves. The focus right now, particularly after, I think, the relative success of encouraging people to stay home during the long bank holiday weekend is to keep up that national effort, to keep the social distancing measures in place. And there will come a time in the future where we can talk about relaxation or transition, but we're not there now.
We're tracking behind Italy. We're following the same sort of path. What do I expect to see happen? I think this week's difficult. I think this week we're going to see a further increase. Thereafter, we should see a plateau as the effects of the social distancing come through. That plateau may last for some time and then begin to decrease. Yes, so if you look at the effect on number of cases in the community, you'd expect the measures that have been put in place to cause quite a sharp decrease. Unfortunately, with the deaths, there's not only a delay, but we would expect there to be a much more gradual decrease from the peak time there, and we'd expect there to be a bit of a plateau. If you look what's happened in other countries, that's what they've seen, that's what we'd expect. You'd expect that to go on for 2 or 3 weeks, but I can't be absolutely sure on the time of that.
Obviously, everybody who sadly dies the doctor will make an assessment based on her or his view about what the cause of death is. That's what the death certificate says in all cases, and doctors take it very seriously and try to make sure that they get as much information to give accurate data. Now, one of the things we want to do is to extend the amount of testing of people in care homes as the ability to test ramps up over the next few weeks. Because clearly, care homes are one of the areas where there are large numbers of vulnerable people, and that is an area of risk, and therefore we would very much would like to have much more extensive testing in that setting, and that will help with this.
The aim all along, and clearly Sir Jeremy Farrar has been part of the group, has been to get the numbers down, make sure that we keep the numbers below NHS capacity, and ensure, therefore, that the NHS can function. And that has been an absolute aim in this. And so far, that is exactly where we are in terms of keeping this under control, with heroic efforts from the NHS, including increasing capacity, and the superhuman efforts of the doctors and nurses and all the others who look after the patients. The direct comparison around things, I think we need to wait and see how things evolve. There's a long way to go yet in this disease. It's still a new disease. It still hasn't spread everywhere across the world. It still hasn't actually been allowed to be released from places that have got lockdown. So I think we've got a lot yet to see in terms of where this ends up. Clearly, it's going to be very important that we concentrate on things like vaccine and therapeutics to get there. I think the measures that we've got in place are holding it in the right position in terms of keeping numbers down and NHS capacity at the moment.